it's important to remember that there are things that can be associated and you do not have to be one. And that's one of the big things that I see is people, they get kind of put into this little box and they're like, oh, well, that's the one I've got. And it's like, well, is it really the one you've got? And that's what we are going to keep talking about. Now, females are definitely much more likely to end up with POTS. That's nearly 80% are going to be females. Okay. So it's females way more. I've seen it in teenagers and I've seen it in adults. It kind of hits the full spectrum. So no one's necessarily immune from it on the female side. What should we actually be asking people who have POTS or we're suspecting them to have POTS? Now, I do want to make a notice that dysautonomia, lots of people are like, well, I've got dysautonomia or I've got POTS. Well, dysautonomia is an umbrella term. POTS is a specific type of dysautonomia. So if you did not have the criteria up front and you did not have POTS, you can have dysautonomia. Now, I personally see that these individuals are able to be treated fairly similarly and get good outcomes when we see these things that I'm going to show you. But the first thing is all about detective work, finding the clues. Everything in healthcare is about pattern recognition. So I often ask people, what are 5 things that make you feel better or worse? List them and list them in the importance of how they impact you. Because based upon that, that's going to give us clues of where we should focus on, right? What happens when you get stressed? Does it change how you feel? What about sleep? What if you lose an hour of sleep? What about food you're eating? What about menstrual cycle issues? What about visual stimulation? What about cognitive challenges? You're at work. What about driving, taking all this visual input? And are you getting sick frequently? Or if you get sick, does it take you longer to recover than it should? And if you get sick, does it tend to flare up your symptoms and then it lingers beyond the time you're actually sick? Based upon how you answer those questions, it starts shifting in my mind. Which type are you, right? Up front, in my mind, right? Cardiology's already done their workup. I'm going at it. You're 50% neuro, you're 50% immune system based. And these questions start shifting it. So menstrual cycle flares you up. If stress flares you up, you're getting sick frequently, then that shift, make me think, well, maybe there's a good bit of immune system related issues versus, hey, when I'm in a car, man, that's just really rough on me.